Hello. This video is to discuss my position in the argument that RNs must be credentialed in their specialty areas. I am against this, but before I proceed, I would like to share with you a conversation that I had with an English professor recently about the word must. He seems to suggest that the word must indicates a requirement, a demand, an obligation. For example, you must go to school if you want to become an RN. Otherwise, you will not be accepted into the profession. So for me, this argument is about forcing nurses who choose to work in a specialty area to obtain credentials. Again, I do not think that the system should force nurses to get credentialed in specialty areas. Before I begin, let me just say that I agree with my opponent's certain aspects. That certifications are accessible, they enhance nursing knowledge, they offer an opportunity for learning. However, I do not share the sentiment that nurses managers, or patients are more valuable based on their knowledge and performance. So when I first laid eyes on this argument, I thought, yes, of course nurses should get more education. Of course they should get more credentials. More credentials are better. But as I dug deeper into the conversation, I realized there's no evidence to support this belief. Evidence seems to suggest even that patient outcomes and satisfaction are unchanged in hospitals where nurses hold more credentials. And even one study suggests that there were more wounds in hospitals where nurses had more credentials. So as I began to reflect on why that may be, I realized that it makes sense. We all went to school with people who, with high performance, high productivity, high GPA nurses. These nurses, they perform well. But when you put them in a room with patients, they freeze, they're unnatural, they regurgitate knowledge, they lack listening skills. So overall, they lack ability and capability, but they perform well. In addition, most nurses today hold back in nursing. With this shortage, I believe nurses should concentrate on being with their patients rather than getting more certification. Lastly, I believe that nurses get the motivation they need to complete credential from their eagerness to learn. There's no need for organizations or government to tell nurses what to do. It comes from the inside. Nurses already want to learn. Thank you.